say you love me. Do-do-do-do. Yeah, 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 baby. Say you love me. Say that you love me. Say that you love me. Say that you love me. Say.
Good evening, good afternoon, good morning, ladies and gentlemen. Thank you so much for joining us. One of the biggest questions I've been getting in the last 2 days is this webinar for men or for women? In fact, some men were telling me you have decided to address women only. And my answer has been that today is actually one of those conversations that is most important for men, because we really need your support. We really need your energy with us. We also need your money. Anyway, good afternoon, good morning, good evening, ladies and gentlemen. Thank you very much for joining us. My name is Grace Nzula. I'm a HR consultant and trainer with Atara Solutions. Atara Solutions is a HR consulting and training firm. We offer 4 services. We offer HR consulting. If you're looking for somebody to do your job evaluations, if you're looking for somebody to work on your policies or review or upgrade them, if you're looking for somebody to do your HR audits, if you're looking for somebody to support you in compliance, where we do documentation, do your employees have contracts? Do they have job descriptions? And all the other important documents in HR, we also do that. We also offer what we call HR manager outsourced for organizations that don't require full-time HR. You can outsource the HR department to us, and we can agree on visits and support you and HR end to end. And we also offer talent sourcing, where we do recruitment and selection. If you're looking for talent, for all the business owners and HR professionals on the call, we support you in getting talent for your organization. We also offer learning and development, where we offer all soft skills training, all HR trainings, and we customize trainings depending on your needs. We offer coaching, we offer mentorship, and we also offer team building services. So please reach out to us on info@atarasolutions.co.ke if you need our services. And of course, this is Get It Right with Atara Solutions, and we are very, very excited for the conversation today. Get It Right with Atara Solutions is a webinar series that seeks to demystify issues in employment and entrepreneurship. We do this every Tuesday from 8 o'clock. And we have been doing this for the last 6 years. We will be 6 years in June. And we start in January to November every year. So if you're new here, you're joining us for the first time, please go to our YouTube channel and get to know or catch up with the sessions that you might have missed out on. And we're very excited that this Mother's Day we get to spend with you. We have declared May, just like March, International Women's Day. We have also declared that May is our month. So if you hear me saying Happy Mother's Day next Sunday, please say Happy Mother's Day as well. So at this point in time, Richard, are you on the call? Richard, are you on the call? All right. I guess Richard has a blackout today, so I'm sure he'll join us at some point. My co-host Richard, he is a public speaking coach and also an interview coach. So tonight we are privileged to have my good friend who is not new to Get It Right with Atara Solutions. She was here and she really demystified elephantiasis. Let me just use the word I know. Yes, we shall. Lymphedema. Thank you. Yes. So, and we had really an insightful session. And tonight we are looking at the conversations that we are not freely having in our, they don't make it to our dining tables, they don't make it to outside our bedrooms, Sometimes they don't even make it to our chama. And for us women, that is something that is very serious. If you cannot have a conversation with your lady friends, then it means that it's serious. And for the men on the call, we really appreciate you being here. And of course, allow me to give a shout out to our partner, Herbert Zake of Stedman Quality Solutions. Stedman Quality Solutions is a HR and public relations consulting firm based in Kampala, Uganda. And it's headed by my very good friend Herbert Zake, who is a Gallup's strengths coach. If you're looking for a coach, Herbert has coached over 500 executives, and he does an amazing job in sharing our webinars in Uganda, and he's a partner in many other things, especially for HR. So if you're looking for somebody to help you recruit your board members, board evaluation, and train your board members, then Steadfast Quality Solutions are your go-to people. So we appreciate your partnership. And of course, K2 HR Services based in Rwanda. If you're looking for HR support in Rwanda, please look no further. We have K2 HR Services. So at this point in time, we want to learn more about Pelvic. And with us tonight is none other than Victoria, who is a specialist on matters pelvic. And she's going to tell us more about what she does and why it is important to have this conversation. And she brings her friends along. And tonight is going to be one of those webinars you wish you never missed. We are going to also have lived experiences, like we want to call them. And we have people who are open enough to share with us their experiences on this matter. So karibu sana, Victoria, you can take it away.
Thank you very much, Grace from Atara Solutions, and for giving us the opportunity, because our aim is basically to try and break the silence which most of the women are going through. So my name is Victoria Musyoka Choi, and I'm a physiotherapist by profession, but I specialize in pelvic health and lymphatic dysfunctions. So we run a clinic. We only have, that is the only one specialist clinic in East Africa, called Lymph and Pelvic Care Kenya, which basically handles matters of lymphatic and pelvic dysfunctions. And these are issues which are less discussed, and they are very intimidating, or they make women really have low self-esteem. And so tonight, we gave back as a way of giving back to the community. We decided it was good to have this conversation, have a talk, as we wish all of you happy Mother's Day. It was on Sunday, but we decided we can celebrate, like Grace has said, the whole of this month. It's our month. So I'm going to take you through and understand the few things which basically you need to have discussions about. You can talk with your husbands about, you can talk with your friends about, and you can empower another woman, so that at least all of us, we can be able to get out of it and regain our strength, our confidence, and our self-esteem. So I am going to share the screen. And today we are going to talk about the silent struggle, which is real conversations on pelvic health and motherhood, because every mother deserves to be heard, supported, and healed. And why we chose this topic is because most of this time, as mothers, when we go to the clinics after giving birth, then you find that we are never given really that much attention. And why? Personally, being a mother, even when I went back for my 6 weeks postpartum, I think there are a few questions which I was asked, and one of them was, is a baby breastfeeding well? Do you have enough milk? Have you gotten back your periods? And you need to think about which contraceptive to use. And I was left there thinking, okay, as a mother, how do I bounce back? And for me, my first birth had a lot of challenges. And the challenges, they came with a lot of challenges of pelvic health issues, with a lot of pain, with a bit of prolapse and leakage. And all these actually encouraged me when I was sorted out it encouraged me to take up the training and become a champion in pelvic matters in East Africa. And so that is why I don't shy off when I talk about pelvic matters, because as women, we're going through so much. And this is something, as much as we enjoy the bundle of joys we get, we remain really mentally disturbed, we remain physically disturbed, and we are confused on how to bounce back as women. So let's look at the unspoken reality of motherhood. As a mother, you're wondering, am I going to really talk about it? So pregnancy and childbirth basically reshapes our woman's body. And the struggles which basically come after that, they are rarely spoken about openly. People don't talk about them. You realize that, oh, I'm having a leakage when I cough, I'm not okay. If I have sex with my husband or my partner, I'm not feeling I'm okay with it. Or sometimes even there is leakage of the stool. You're wondering, what is all this? You have a lot of pain. You feel something is bulging in your birth canal, and you're like, back pain is there. You bend, you have the baby here. So you're really trying to task so many issues around your body, but at the same time you have to take care of the baby, you have to take care of the family, the whole family. Everyone is looking at you as a mother. So many mothers experience all these pelvic floor issues, but basically we stay silent. And why do we stay silent? It's because most of the time when we talk with friends, they will tell you, but that's considered normal after birth. That's usually the answer. But the truth is, it is not normal. Why? Because it brings shame, it brings a lot of stigma issues, and simply not knowing help exists and limited conversations in community, then it makes you get silent about it. So what's the range of these pelvic floor issues? So here we are talking about urinary incontinence, which is basically what we call urine leakage. We have stool leakage. We have, and this stool leakage is very common, and especially when women have perineum tears or episiotomy, which are third degrees, they will get actually stool leakage. You have a lot of pelvic pains, back pains. If probably you've gone through cesarean section, you will get pain on the scar tissue, and you'll keep on wondering, why am I having pain here? But the scar is closed, it's healed, but of course the tissues are pulling inside, so they will give you pain. Sometimes you will experience pain during intercourse, or sometimes you don't actually feel your partner, and you're like, I don't feel it well. Then your partner will start saying, oh, you're cold. Oh, my wife is cold. Ako baridi. So that's the word they use. And you're like, you know what? Yes, it's just because these pelvic floor muscles, of course, they stretch. And when they stretch like 3 times the way they're supposed to stretch. Normally, for a woman to open and give birth, it's usually 10 centimeters. And the normal width of the vagina is 3 centimeters. So you can imagine if you take a rubber band and try to stretch it, and you stretch it for that long, the way we go through labor. So stretch that rubber band and leave it back again. It will not have the same elasticity. So those are some of the things definitely which happen to us. So the muscles become loose. And of course, sometimes now that brings about now the incontinence. It can also bring about what we call prolapse. And prolapse is actually a descent of any of the internal organs. It can be your bladder, your rectum, your uterus, or your vaginal wall. So you feel like a ball is blocking the way, and you're like, I don't know what's happening with me. So that's called a prolapse. So these issues are real for mothers. They are common and they are treatable. And they don't just appear because after birth, after giving birth. Sometimes yet you might feel like you're okay. But as we age, then what happens? Because these muscles definitely, they were not toned from the word go. So what happens is that they go also wasting, just like the way our muscles in the body are wasting. Remember, these muscles are very intrinsic, they are inside. So it's not something you see. So sometimes it's very easy to assume them and think that you're okay, but you're not okay. And this brings the conversation as to why most of the time you'll find, like our mothers, they will either wear the liners, or you'll find them with pads, or sometimes like they even avoid taking fluids because they don't want to rush to the toilet. So they get actually dehydrated, and that brings also other problems. But the truth is that these experiences are not something mothers simply have to endure, and awareness is the first step now we are dealing with. So I want to take you briefly about understanding your pelvic floor, so that at least as we discuss about these matters, you try to imagine what is that pelvic floor. So the pelvic floor, when you look at these photos, if you see the colored ones inside, those are the pelvic floor muscles. And just on a nutshell, this is the way they look. That is the way they're interconnected. So they look like a pelvic clock. And that's why we say that they are like a clock. And when it's a clock, we look at it in terms of 12, 6, 9, 3, and you can see the way they are labeled. So all those muscles are pelvic floor muscles. And that's where we look from inside. So we say they are a group of muscles, and those muscles are conjoined together. So they attach at the front, at the pubic, and at the back of the tailbone, and then on the side of the two sitting bones. And so they form like a hammock structure. And so they are supposed to be able to bounce nicely. They are supposed to contract nicely and release nicely. That's when you feel actually, yes, the muscles are healthy. So these muscles are very important because, number one, they're the muscles which support our internal organs. Down there, we don't have bones which are hanging there. No, we just have our muscles, pelvic floor muscles. And those muscles, they work 24 hours. So it means that whether you're sleeping or standing or sitting, it's the pelvic floor muscles which are working. So if they're not strong enough, then definitely these organs will drop down. And sometimes when they drop down, they start from degree 1, they continue to degree 2, because definitely the pressure is there every day. We've not learned about the techniques of preventing the organs from dropping more. So they get to degree 2, they get to degree 3, they get to degree 4 where they are hanging outside. And degree 1 and 2, it's easily reversible through pelvic physiotherapy, but this has to be done by a pelvic floor physiotherapist who knows exactly what they are doing. Grade 3 and 4, you have to go through surgical intervention, and then you're referred back again to a pelvic floor physiotherapist. So these muscles, basically, they are the ones which support the organs. They control the blood and the bowel function. How? So if these muscles are not working well, you'll find that you cannot be able to pee nicely, or you cannot be able to poo nicely. So, and this is the reason as to why you will get even a number of women with pelvic floor issues, they have constipation. That's one reason as to why you will be like, why, how is the relationship between my pelvic floor and constipation? Yes, because they are the ones basically which are supporting the rectum. If you're not able to pee well, sometimes the muscles can be too tight. And remember, tight is not strong. So let's not confuse those two things. And you find yourself when you go to the loo, you're not able to empty your bladder easily, clear everything. And that can actually give you persistent infections. And that you will be like, oh, I think things are not okay in my house with my partner and all that. But then the truth is, it can actually be because you have a very tight pelvic floor muscles, which are not allowing the bladder to open freely. So these muscles also are very important because they support our sexual health and pleasure. So if your pelvic floor muscles are working well, contracting nicely, they are strong, definitely you will enjoy sex. So they also contribute to core strength and stability. Why? Because the pelvic floor muscles, I've told you, they are attached at the pubic and back at the tailbone, and then on the two sitting bones. So basically, they're the ones which really stabilize the spine and stabilize our stomach down there. So if they are not strong, then definitely you realize that you will feel like your core is not strong. If your core is not strong, then it affects your pelvic floor. That's why most of the women, even when they have back issues, you will hear men say that is sickness which is for women. It has been labeled like that mostly. Why? Just because the pelvic floor is weak. So the pelvic floor also is the one which helps us anyway to enjoy also being mothers. And this is in terms of pregnancy. When you're pregnant, basically you carry that baby. It is the pelvic floor which is supporting that baby down there. And during birth, is the pelvic floor muscles which open to allow the baby to pass. So this is really a great foundation for us, and we really need to be conscious about it. Let us not just work on our outer part to look nice and then we ignore our inner part of it. So we have bones, we have muscles, we have ligaments, connective tissues, and nerves. And all those ones are affected if our pelvic floor is not working well. Let's look at the first chapter of change. Basically, the first chapter of change is a pregnancy. So before delivery, of course, the body begins to shift, and there are all those hormonal changes. The uterus is growing, and there is a lot of sustained pressure on the pelvic floor all through the 3 trimesters. So this basically can bring urinary leakage, pelvic pain and pressure, and we are saying that recognizing and addressing these signs during pregnancy will really help to reduce the risk of the long-term complications after delivery. Because for sure, if you tackle them early, then you find that even after you give birth, you're easily to bounce back easily. And unlike somebody who was not conscious about giving attention to the pelvic floor when they were pregnant. So we want to look at few of the issues which as a mother you can be able to get. I think I've talked about urinary and fecal incontinence. Dysfunctional voiding, it's basically what I've said, that sometimes you can be able to go to the toilet, you want to pee, but the urine is not coming out too nicely in a nice stream. Sometimes you finish, you step out and you feel like, wait a minute, I feel like I need to go back again to pee again. And then you go back and you pee again and you feel, okay, I've emptied. Sometimes you go back, nothing comes out. Pelvic organ prolapse, I've talked about it. It's the descent of the organs. Dyspareunia is basically painful sex. Vaginismus is where one cannot be able to penetrate. And this is actually very common. And nowadays, it's more so much associated with mental health, psychological issues, and all that. They really affect the pelvic floor muscles because the pelvic floor acts like a second brain. And how you want to know about that, it's because when you're scared, most of the reaction is like you either, if you scare, let's say like you scare a baby, you'll see those babies, they try to put their hands in between their legs or they pee. So the pelvic floor acts like a second brain. The other thing is vulvodynia. Vulvodynia, it's basically where you feel like burning sensation around the whole vulva. You're like, even if you sit down, you can't even wear your panty. You feel like there is burning pain, which you cannot be able to explain. Sometimes you go pour cold water on it and you're like, nothing is happening. There is also the overactive bladder, and this is overactive bladder is very common, and especially with mothers who have gone through CS, cesarean section. Why? Because of the incision and all that, it tends to pull the pelvic floor muscles, tighten them so much, and this happens that when you go to pee, you pee a little bit, you get back, and because you've not emptied, after few minutes, you feel you want to go again. So you frequently keep on going back to the toilet. So there is also the chronic pelvic pain where you feel all the pain around the back. Sometimes you're feeling on the thighs coming down. Sometimes you're feeling on your hips. So that is very important. So there is also a dysfunction of pre and postnatal care. You might not be having all these problems, but the truth is your pelvic floor muscles have done a lot of work. They have overstretched. So you actually need to be rehabilitated to get back to function. So there is what we call DRA, and TRA is what we call diastasis recti abdominis, and this is what we call diastasis of the abdomen. So sometimes you find there is that separation, and once that separation happens, then you find that your back is not stable. You feel like there is a heaviness on your back. There is a gap in your stomach. When you try to bend down to pick something, you're like, you cannot manage. So this is something which happens, and it just happens because the baby is growing. So normally when you see the baby is growing, you see the tummy is getting bigger. There is a line at the center there. So there is a big muscle which basically supports, we call it rectus abdominis, which supports the abdomen, and it is the one which separates. So this is very common with mothers. For mothers who really exercise and all that, then sometimes you might not really get the diastasis. But then if you don't exercise, it might be a burden to you. Then we have the abdominal and pelvic scar tissues. Those ones I've talked about them. We also have persistent genital arousal disorder. And this is a disorder which basically you feel like because of nerve interference, it mostly comes because of the nerve interference. So the nerves which are supplying the pelvic, they might be interfered with when you're giving birth. And especially like if they do vacuum or the baby is pulled, maybe the baby was not positioned well, or sometimes even cesarean section, can actually happen that the nerves are touched. When they are touched, then it gives you that persistent genital arousal disorder. You actually feel like every minute you just want to have sex, you are aroused. But then it's not resolved by sex. It is just there. So it's a condition which happens because of nerve issues. So of course I brought in the issue of the prostatectomy because I knew we are going to have men here. And of course, men they also have pelvic floor issues. They have a pelvic floor like any other person. The only difference they have with us women is just the outside. Otherwise, the inside we are the same. And they experience most of these challenges which are there. Oncology, of course, and especially one has cancer of the cervix, then they're likely to experience a lot of pelvic floor issues. And also even any other cancer, the treatment for it basically gives hormonal disturbance, and that can affect the pelvic floor so much. So let's look at the road to recovery. We are saying that whether childbirth, whether vaginal or cesarean, it places extraordinary demands on the body. And vaginal tears, episiotomies, and C-section scars can all significantly disrupt pelvic floor function, sometimes in ways that aren't immediately visible. You might not really see those changes immediately, but they will affect you as you age. So one of the gurus of the pelvic floor physiotherapy, Catherine Sylvester, emphasizes that pelvic floor physiotherapy, it's very essential. They are basically essential partners in postpartum recovery. It's not a luxury, but a standard of care every mother deserves. So don't look at it as terms of luxury. No, it's actually a standard care. And in Europe, you'll find that most of the countries like France, they insist every mother who gives birth must undergo 10 sessions of pelvic floor physiotherapy, and it's a must. Why? Because they understand prevention is better than cure. So they don't wait until the mother start having all these problems, and then they drain even their medical covers on something which would have been prevented before. So I want you to look at that photo. That mother is wondering, have given birth. Yes, but I'm looking pregnant. What's happening with me? Definitely, that's a mother who is having challenges, so many of them. And the effects, they reach far beyond just physical discomfort. And when left undressed, basically, one of them, we are looking at the mental issues, which is mental health. So what does it bring? If you have pelvic floor issues, it brings anxiety, depression, diminished self-esteem, which is basically closely linked to untreated pelvic dysfunction. Intimacy, you're like, do I actually want to get intimate? How am I looking? I'm not feeling my partner. What's the purpose of all this? Definitely, it also affects the quality of life. So you limit activities which basically as a mother you love, some of them like exercise, travel, you're wondering, am I going to travel and I'm leaking? Am I going to social gatherings? And in case I cough or sneeze, something comes out. And maybe I did not even wear a pad, or maybe the pad I wore, it's actually soaked and it's smelling. Do I want to go to gatherings and I sit down and I'm feeling a lot of pressure in my pelvic? So basically, it affects a lot of quality of life. And even like you will get mothers who are going through all this, they will keep on going to hospitals to be treated, seeking the gynecology care and all that. They are sent to orthopedic. So even the work is disrupted because of just things which could have been controlled immediately after birth, which is like 6 weeks postpartum. That's when we start the rehabilitation. So we are saying that many women suffer in silence, mistakenly believing these issues are normal, an avoidable part of motherhood. But the truth is, they are not. So, as women, are we able to break the silence and have the power of conversation? If we go for our chamas, if we go for workshops, are we able to talk about it? Are we able to encourage others that these problems, talk about your problem, and your problem you realize when you talk about it, another one will speak up and say, oh, for sure, this is also what I have. I'm also experiencing this. And you'll be able to give each other advice and say, you know what, you can be able to be sorted out. You only need to visit a pelvic floor physiotherapist and you'll be sorted out. Let's create that dialogue. Let's build community support, especially workshops and educational events. And this is one thing as to why you will find that for me, when I go for my ladies, when I meet ladies, I talk about it freely. So let's be the champions of the others. Talk to them freely. Talk to your daughters. Talk to your nieces. Talk to your mothers. And let's see how we can be able to grow a greater community. Recognition is growing, basically, even in the medical community, and everyone is also catching up. And that's why in Kenya right now we have pelvic floor physiotherapists. There are quite a number of them, definitely. And if unless somebody trained and is not practicing, but for sure we can reassure you that like in our facility, we are 3 of us well trained in pelvic floor issues, and you can be assured that you will be sorted out if you have any of these problems. So seeking professional help, it's very important. And basically, we say that pelvic floor issues is not about Kegels. So don't just think that, oh, if I do Kegels, I'll be okay. Because it's not everything that deserves Kegels. Sometimes we might be very busy doing those Kegels, as we call them, which of course some mistake them. And how they mistake them, sometimes they go to the loo, and you're going to the loo and stopping the pee and releasing it again, stopping it again, and you say you're doing Kegels. No, you're basically damaging your muscles. So not everything that is actually about Kegels. So the treatments, when it comes to the pelvic floor physiotherapist, we are trained on how to assess, diagnose, and treat the full spectrum of pelvic health concerns. And that is even before, during, and after pregnancy. And how do we go about it? One, there is personalized assessment. So we do a thorough assessment externally and also internally so that we really understand your problem, because every pelvic floor is unique in its own way. So then we give targeted treatment. So when we talk of targeted treatment, like I've said, it's not every treatment fits all. So some will require manual therapy, others will require pelvic floor muscle training only, others will require pressure management, lifestyle modification, others will require biofeedback, and we offer all these depending on the assessment. So ongoing guidance, support for preventing future issues and building long-term pelvic strength and resilience. That is actually ongoing guidance that when you come to us, we've assessed, we've given you treatment, then we always give you a program to do at home. And when we give you the program to do at home, you can always be able to book, even if it's once in 3 months, just to reassess your pelvic floor and see how it is. It's not necessarily once we are done with you that you come and we do an internal check. We have a machine also, which is a biofeedback machine, and basically can test your strength of pelvic floor muscles without actually removing your clothes. Let's look at, as mothers, we need to empower each other. And what are we saying? As a mother, take control of your pelvic health. Why? Because you deserve to feel strong. Reclaim your body after pregnancy. It's very essential. Do proactive pelvic care during and after pregnancy so that you can be more healthier, comfortable, and more confident as a mother. Educate yourself about your body and the changes pregnancy brings. Speak honestly and openly with your obs-gyna doctor, with your midwife, with your primary care provider. And if you realize that, oh, I'm not getting there, I have this problem, I'm not feeling like it's getting resolved, don't rush for surgery. First, ask for referral to a pelvic floor physiotherapist and take it as a preventive measure. So your pelvic health matters. It's a foundation for every mother's well-being. So prioritizing pelvic health is not a luxury, it is a necessity. And every mother deserves to feel supported, informed, and empowered in her body. So at this moment, as women, what I'm going to say is, know your body, break the silence, share your stories, and please seek support. That's me, Vicky, and that's the pelvic machine which we use. We can be able to check the strength of your pelvic floor muscles without actually removing your clothes and train it. But mostly we usually encourage the first assessment. We need to do a thorough assessment so that we actually know what are we dealing with. And that's a flower. Thank you very much. Back to you, Grace.
Yes, I was wondering when the other team was coming on, or should we continue?
Sorry?
The other team, the other guys, they were
Yes.
supposed to share.
So at this moment now, we have few ladies, and they are going to talk about their journey as mothers. And since they have gone through the pelvic health rehabilitation, they have taken charge of themselves. They decided to break that silence and talk to the women here so that at least all of you can realize that, yes, there is a solution. So we are going to start with Sylvia Jao. Sylvia, are you there?
Yes, I'm here. I hope you can hear me.
Yes, we can hear you.
And Victoria, Sylvia
apologies.
comes on. Just 1 minute,
Yes.
Sylvia. As Sylvia comes on, there's somebody asking about your clinic on the chat. You can be answering that. Sylvia, go ahead.
Okay. Thank you.
Apologies if you hear a dog in the background. I have to be outside because I'm a mom of little babies. That's why I'm here. So I think for me, just to make it's a long story, but just in brief, I have two babies and they were born, one in 2023 February, and my second born was born in November 2024. So those are two pregnancies that are really close. And I don't think I ever thought about going to a pelvic floor anything or anyone. The only care I knew for pregnancy and childbirth is the gynecologist and the pediatrician. And so after my first baby, I felt my pelvic floor had changed, but I couldn't put words to it. I couldn't describe. I just felt a difference, a heaviness of sorts that went away over time, and I thought that was okay. So I had my second baby. Now, after my second baby is when I realized we have problems because there was a heaviness I could feel. I could feel like there is something tethered to my pelvic floor and I'm dragging it around. And then afterwards, I realized I had developed some form of incontinence. I could not laugh and not lick. I could not sneeze. In fact, one time I had a cold and that was it. The coughing meant wet pants, and now I was shopping for the most absorbent liners, and I discovered there are liners for incontinence that I didn't know exist. And then with that is a lot of discomfort. You will get a rash similar to a diaper rash. Me and my daughter were sharing the zinc and castor and the pants and nama inaitwa nini. And 3 months down the line, when my baby was 3 months old, I had to go back to work. Now I'm going back to work and I cannot even laugh at a joke in the office because who knows what will happen. And I did go to a gynecologist and one gynecologist who is very vocal online. So I visited the clinic, and the first thing after examination and everything, I was given the scare of my life. I was told that my pelvic floor is a bit a mess. I have some form of prolapse. And I was told that it was to some third to fourth degree thereabouts, and that I need surgery to tether my uterus to my back. It was basically scary thing. Let me just not go too much into the scary details. And my heart sank, and I decided if it will come to this surgery, that doctor will do it and do a tubal ligation because there's no way I am ever going to go through this again just to have another baby. And right after that, I really, and this is the importance of seeking a second opinion. So my husband advised that I just seek a second opinion from someone who is not running that private clinic, someone who is in an institution where they don't really necessarily stand to gain much if surgery is my only option. And so I went to a big hospital and I saw a urogynecologist there. Dr. Miheso, I'll mention him because he really helped me. So when I consulted with Dr. Miheso, he checked me and he was like, but there you're not really badly off. In fact, this one, you only need a pelvic floor physiotherapist and you'll be okay. And I could not believe, in fact, I sort of doubted him because I am more of I had really believed that other surgery thing. It took 3 months to even go to another doctor because I didn't want it to be confirmed. So he gave me Vicky's contact and I went to her clinic, and I could not believe that I can have this conversation and not feel ashamed. Because even when I was talking to my friends, I couldn't even express myself openly and say, you guys, I'm leaking urine. That statement could not come out of my mouth. Like it's just the shame attached, and I don't understand where maybe it's because no one has ever spoken about this, not from our parents or anywhere. And so sitting with Vicky, and she took me through basically what she's taken us through, but maybe in more detail and more personalized, because now I had filled out what was going on with me. And I think I felt like a weight had been lifted off my shoulders. And I did faithfully sessions twice a week. I think it was sometimes maybe thrice. And one of the guy actually saw three gynecologists. Another gyna I had seen before had given me videos to watch on to practice Kegels. And I realized when you watch videos online to do Kegels, you will do the wrong thing because you don't know how to do them. And it's very important. One thing I gained from going to a professional is that she taught me exactly how to do them. And by that, she'll guide you and tell you, no, this is not the right way. This is wrong. You might end up doing this, that, and the other. And I learned that I was doing nothing for about 6 months thereabout. I went to Vicky December 2024. My baby was born in January 2026. My baby was born November 2024. So I had a whole year of stress and turmoil and suffering, not knowing that there was help out there. And after going to a professional, can you imagine within how many weeks? Maybe I was discharged in about less than 2 months, I think. And I was fine. It was like a miracle. No more. In fact, I don't even remember how that felt. Maybe I've just remembered when she was describing everything that could happen to you. And I can't believe that I suffered for a year and there's help out there. And I believe it's because people don't talk about this, women don't talk about this. We talk about now postpartum depression, we talk about all these other things that could come, breastfeeding, breast milk supply, all those other things. But we don't talk about the pelvic floor. And I'm glad this conversation is happening. And I'm hoping that everyone who is here would actually reach out to a mom near them and ask them and maybe tell them in case they're experiencing anything of this sort, help exists and you can get solutions that don't have to involve surgery. And I'm really glad. I'm so happy that I found my way, or rather, Dr. Miheso referred me to a pelvic floor specialist. Yeah. I hope I was coherent and clear.
Much, Sylvia. That was good. And thank you for sharing your story. The next in line, we have another lady who has also gone through the challenges as a mother. And definitely we've said that today is conversations. So they were very ready to share their experience. And so I'll invite Susan so that at least, Susan, are you there? Susan? Okay, seems Susan might not be there at the moment. Then I'll invite the next person who is going to share her story. She's not a mother. She's a young lady, not yet a mother, but she's really ready to share her story because she went through a lot of challenges. And I think after she came and we worked on her pelvic floor, she will be able to explain actually how she feels. So I'll invite Minal. Are you there?
Hi, yes, I'm there.
Thank you, Minal. So you can actually talk to us and explain to us your journey.
Hi, everyone. My name is Minal. So actually, I was diagnosed with an autoimmune disease in 2020, where I had full body paralysis, where all my muscles had a power of 0. So I had difficulty in walking and everything. So I had been doing physio since then, but I had just been doing overall physio. I had ignored the pelvic floor part of physiotherapy. So around 3 years from recovery, I used to have continuous UTI, where I had a lot of back pain, pain during my periods, burning sensation, and many more symptoms. So I thought this is something that I need to focus on. So I was first I just saw a general GP on this matter. So I was given injections for this UTI. I was told your UTI is extreme. So I was given injections. Again, it kept coming again and again, recurring. Then I was given medication. I was on antibiotics on and off. Like it's not even been 2 or 3 weeks. Again, I have UTI. It's not been 2. Again, I have UTI. And then at that point, I had decided to see a gynecologist. So I went to like 2 different gynecologists who also gave me antibiotics, same procedure. Again, 2-3 weeks go. Again, I'm back to square one. I have UTI. Again, I have a lot of back pain. Everything was in pain. Then the gynecologist recommended that I see a urologist. When I went to a urologist, I was optimistic that, oh, now this might be my solution finally. But however, he just told me that I have to catheterize myself every 2 to 3 days because I'm retaining urine because of my autoimmune disease that had weakened my pelvic floor muscles. So I was retaining urine. So the only solution to that is that I keep catheterizing myself every like 2 to 3 days to ensure the excess urine, I can just remove it out. Then I just gave up at that point. I was like, no, this is not like really a solution. So I was like very like disappointed and everything. Then I met one of my main physiotherapists, Dr. Sami, and he introduced me to Dr. Vicky, who is like a miracle to me right now as we speak. So I just went to her. I talked about my UTI, everything. We had a conversation. So I used to go to her twice a week for sessions and everything. And yeah, I had back pain and everything. So we used to do 2 sessions a week. And then we just kept reducing the sessions. As we speak now, it's been 2 years that I've been doing sessions with Vicky. At this point, I see her once in a month or even once in 2 months, but I've not had any antibiotics. And she's helped me get rid of medication fully, just with exercises and all that. Like, I never knew this was possible in life because I was so reliant on these antibiotics. I just thought that this is it. This is my life. I have to get used to it. But she made sure that at this point, I'm not having any sort of medication or anything. I'm just doing it naturally with exercises. And yeah, so I'm so grateful that I met her. And yeah, so she's the one who got me to where I am today in terms of my pelvic floor. She's gotten it to be stronger. I'm not retaining any urine now. I don't have any back pain. So she's really helped me. Thank you, everyone.
Thank you very much, Minal, for sharing your story. I don't know whether Susan, are you there? Probably Susan did not manage to join. I think the evening has been tough because of the rains, but we really appreciate Minal and Sylvia for sharing your stories. So definitely women, mothers, you understand now the solution is there. So let's not fear, let's not stay with the problems. We need to seek our care and take health into your hands and realize that you can actually be able to bounce back and lead a quality life. Thank you very much. We can now back to you, Grace.
Thank you very much, Victoria, and thank you, ladies, for sharing your stories. It's amazing to just hear from you and just to know that we are not alone. And you have really, really supported women. And I hope that more ladies will take advantage of this. And welcome, Richard. It's nice to see you. You have really missed out on the first half of the session. And today I have a co-host. Have I shown you? I am visiting my friend today.
Hi. Appear and disappear.
Yes. So we are here because we are women. So we decided to take this call together. But I am liking the conversation on the chat. And for those asking for Victoria's number, she has shared. And I want to read something that was posted by Mutindi Kakuti. She's saying, I am absolutely happy and elated that we have pelvic floor therapists. I'm a gynecologist, and for a long time, I've been wondering when and where we'd send patients. For many, surgery has brought on more complications than solving the problem. So Mutindi, you finally know there's Victoria. And she also talks about, I hear you talking about pelvic floor issues in mothers, but hope that you are cognizant of pelvic floor issues in peri and menopausal women. Some are not mothers. Kindly share contacts for booking appointments and location. And I think that has been done. And I know this one wrote to me on email, Mr. Francis, Dr. Francis. Great to hear this conversation for Kenyan women. I am a urogynecologist working in UK. I work hand in hand with pelvic floor specialists, and I'm happy that, where is that comment? In preventing and managing pelvic dysfunction. And there's a question here from Elizabeth who is saying, when peeing standing and the pee goes to the side, is that an indicative of pelvic floor issues? Vicky, we have started.
Yes, actually, that's an indication that your pelvic floor muscles are weak, and you just need to strengthen them so that you have a good stream.
All right. Mary Maguera says, hi, Mary, how are you? We need to have such sessions. I think we're going to have a conversation on menopause very soon because these are real issues happening to us. And then we have, thank you, Dorka saying, thank you. You have rehabilitated my mother-in-law pelvic floor and she's doing very well now. That is very good. Karo Kenyanju is asking, where is your clinic based? And she has answered that. It's at Lymph and Pelvic Care Kenya. Lymph and Pelvic Care Kenya is located at Park Medical Center opposite Aga Khan Hospital, second floor, room what? 205. Yes. Yeah. So thanks, Atara, for the session. Contacts are there. Sarah Karongo says, great success stories that pelvic floor therapy works. Very encouraging to those asking. There's somebody who talked about having second class, where is that question? They have something and they have been told to go for surgery. I don't know whether Vicky, you saw that.
I think I saw that question. They have a grade 2 prolapse. They have been told to go for surgery. My advice is that grade 1 and grade 2, we reverse it very well with pelvic floor physiotherapy. Grade 3 and 4 is what actually we just tell the patient first go for surgery, then come back to us. So you don't actually need to go for surgery with grade 2.
Excellent. Thank you for that. I think there was another. Yeah, there's somebody asking whether you take insurance.
Yes, currently we are taking Minet, we are in their panel, and CIC insurance. CIC, we are taking them, but meanwhile, they have restricted us to only Safaricom, so probably they will open up to other organizations. And then we have Central Bank of Kenya.
All right. You said cysto cell is the same as prolapse too?
Cystocele, it's a bladder prolapse. So what is called cystocele?
Yeah, so I was diagnosed with cystocele grade 2. My Ghana says surgery is my option. Can I get help without surgery?
Yes, that's the same thing I've said with grade 2. You don't need to go through surgery. We can be able to reverse that and you bounce back and acquire good quality of life.
All right. There's somebody who's saying, what? This was a real eye-opener, and it's good to know that we have specialists who help us understand this knowledge beforehand. And that is why you keep it, get it right with the Tara Solutions. Every Tuesday, we are here to make sure you're well informed. Richard,
yes,
today,
please.
do you have something for Victoria?
Yes, I have a question. I have missed out in my part of the estate where I've rented to stay. There was a problem of electricity. Vic, it is good to see you again. Now, me and Paul, we are seated here and wondering, what is a pelvic floor? What is the pelvic floor? What is that?
Okay, so you missed the presentation, but basically pelvic floor, it's where you're sitting right now, you're sitting on your pelvic floor.
Mm.
Okay, so pelvic floor is composed of bones, the two sit bones. We have the muscles, which are inside. I think I should share that screen again so that you see the photo nicely.
Okay.
We have the ligaments, and we have the nerves. So, and women and men are the same. You have a pelvic floor, Richard. Any other person. The only difference you have is that it's the outside. That is the only thing which you're different from us.
Okay.
Yes, so just taking you back so that you see the photo of the pelvic floor. Yes. So that is the pelvic floor. And basically that's how it looks.
Okay.
Those muscles are very important because they are the ones which are supporting your internal organs. They are the ones which are actually helping you with your sexual function and with your bowel movements.
That is very good. The other question is it a genetic problem? Sorry, I missed some slides. Probably you could have answered this in some slides. Is it a genetic problem or is it something that just pops up? And
it is something which comes up. It's not usually genetic. And most of it probably, especially for men, the contributing factor, most of it is usually psychological stress. That's a big contributing factor. The other one can be enlarged prostate. The other one can be actually lack of exercises of those muscles. Because you go to the gym, you lift the weights. And when you're lifting the weights, you're thinking that you're working on your pelvic floor. And instead, what you do, you tighten everything. And that makes your pelvic floor weak. So you find that you start having issues of erectile dysfunction. But you build nice muscles on your arms, but down there you are nothing.
Okay.
Yes,
right.
So it happens, and it is very common, okay? So it can also be because of the other comorbidities, maybe diabetes, hypertension. And men, basically, most of the pelvic floor issues they are having is erectile dysfunction and inability to hold. So you find the endurance is very, sometimes you can actually be strong, your muscles are strong, but your endurance is very low. So when you get in, you can't even finish a minute or 2 minutes, you are done. Yes.
I love the choice of your words. So like I can come there and you do a diagnosis and then prescribe.
We do a diagnosis and give you a program of exercises to do to strengthen your pelvic floor muscles.
Is it only exercises or the medications, diet?
We don't use medication at all.
Yes.
We only deal with the exercises.
Okay.
And lifestyle modification. So we'll teach you if your pelvic floor is as a result of constipation, how do you need to change some of your feeding habits and all that? How do you need to change your lifting techniques? How can you be able to relax your pelvic floor muscles so that they contract nicely and relax nicely to pump enough circulation in that area?
Okay.
Yes.
One of the beautiful things that I'm delighted about, you are demystifying the concept and the shame that is associated with it. People are lacking knowledge, not because there is no solution to that problem, that there is a solution. What people are lacking is having a conversation around it, and people will get prescription for lack of a better word. Thank you so much.
Yes, and that's why I said that not all exercise is not a one fit all, because people have different presentations when it comes to the assessment. So once we assess, that's when we can be able to guide. Sometimes people just think it's about Kegels. I say that it's not about Kegels, because you might be working on a pelvic floor which is too overactive, it's too tight, and you are exercising, so you make the situation worse. Yes.
So it is tailor-made. It is tailor-made to that particular patient.
To the assessment.
So the reason why I'm saying it is tailor-made, because it worked for me, certain regimen of exercises worked for me, does not mean it will work for the next person. This person who is also having a problem can come and have their own prescriptions, so to speak.
Yes. Yes.
Okay. All right. Thank you so much, and God bless you for that one.
Thank you. Yes.
Amazing, amazing. Thank you, Richard, for representing the men who could not ask. I see Henry saying, great presentation. Vicky, keep up the good work. Christine says, which types of exercise do you recommend? I think Vicky has answered and said that after diagnosis is when they can represent. Charity Wakesho says, God bless you, amazing presentation. And I totally agree. I wish we had more time to continue this conversation. This is a conversation that's never ending. And I hope you're more enlightened now. And if you hear a woman saying that they need to go and see a urologist for one reason or another, or these things. And oh yeah, there's somebody who said about training. I see Vicky has answered. I think it was Mutindi, who is in Eldoret. We normally don't share slides, so we are going to share the recording, so you can always follow through with the recording. It's going to be posted on our YouTube channel. Paul, you can share that just now. Where we shall share, but you can always get in touch with Vicky. She can also come and do conversations and these lessons in your workplaces as well, so that we can know how to support our workmates. I know somebody, my training teacher told me that, Grace, you need to put this in perspective of performance and productivity in the workplace. And today was more of an awareness creation session. And so next time we're going to come in and say, if you hear a woman asking for permission to go and see Vicky, please give them. We need it. We need it. So they're going to need to leave probably, yeah. So anyway, thank you so much, guys, for joining us. Before I welcome Vicky for her parting shots, I want to welcome you to Meru. We are traveling to Meru on the 5th of June. We are going to be at Slopes Hotel in Meru on 5th of June from 4 o'clock to about 8 or 9 p.m. And we have two wonderful conversations live. It's going to be a live session. Yes, it's going to be live. And we are going to be discussing labor laws, the emerging issues, what is new in the labor market. And we're also looking at taxation. What do you expect from the taxman? Is a conversation we're going to be having down in Meru. So please do join us if you're in Meru or its environs, or you want to do a road trip. Please join us in Meru on the 5th of June from 4 o'clock at Slopes Hotel. Right. Vicky.
Yes.
Parting shots.
Thank you very much, Grace, and the rest, and all the participants for attending this webinar. Let's spread the gospel that pelvic health is our foundation as women and as men, and without it, we cannot lead a quality life. So parting shot for women is that in order to grow old as a healthy woman, you need to remain healthy as a young woman. So take charge of your health. Thank you.
Thank you very much, Vicky. It's always a pleasure to have you. And thank you so much for really, really spreading this gospel. And I hope the 110 people who logged in today can be able to seek support for their friends, their families, and the men as well, led by our male ambassador, Richard, here, with Paul as well, and Henry, who logged in as well. So please join us in Meru on 5th of June for a wonderful road trip and an amazing conversation. But before then, we are going to be here next Tuesday. It's actually coaching week, so we are hoping to have a coaching conversation next week. How do you coach your staff members? How do you coach yourself? And how do you become a better coach in your life and other people's lives? And you know, nowadays, even parenting is a coach. You're supposed to approach it with coaching. So next Tuesday, we are going to be having a very wonderful conversation again, making sure that you join us. We are here at 8 o'clock every Tuesday. And you can join our WhatsApp group for more information, and so you can know what's happening on Get It Right with Atara Solutions. Please follow us on Instagram at Atara Solutions, like our Facebook page at Atara Solutions, connect with us on LinkedIn at Atara Solutions, and subscribe to our YouTube channel, Get It Right with Atara Solutions. From us, myself, Richard, and the entire Atara Solutions team, we say good night. And of course, my co-host is saying
Goodbye.
Have a lovely night.
Nice.
Good night. Good night. Bye-bye.
Bye-bye.
Peace out, Richard.
Well, Richard, make sure you come.
Will come. I'll come. I'll come.
Okay.
I'll
Thanks.
come.
Excellent.
Bye.
Thank you, Vicky. My friend Vicky was on the call. Thank you, Vicky.
Thank you. Bye-bye.
Asante. Bye.
see when your love came down. I could sing of your love forever. 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 Over the mountains and the seas, your river rounded me, and I will open up my heart and let you listen. I'm happy to be in truth, and I will take it pour out all the sea when your love keeps down. I will sing of your love forever. 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 Oh, I feel like dancing. It's foolishness, I know, but when the world is seen light, we will dance with joy like we're dancing now. I could sing of your love forever. I could sing of your love forever. I could sing of your love forever. I could sing of your love You know I can't smile without you. I can't smile without you. I can't laugh and I can't sing. I'm finding it hard to do anything. You see, I feel glad when you're glad. I feel sad when you're sad. If you only knew what I am going through, I just can't smile without you. You came along just like a song and brightened my day. Would have believed that you were part of a dream. Now it all seems light years away. And now you know I can't smile without you. I can't smile without you. I can't laugh and I can't sing. I'm finding it hard to do anything. You see, I feel glad when you're glad. I feel sad when you're sad. If you only knew what I am going through, I just can't smile. Some people say happy happiness takes so very long to find. Well, I'm finding it hard leaving your love behind me. And now you see that I can't smile without you. I can't smile without you. I can't laugh and I can't sing. I'm finding it hard to do anything. You see, I feel glad when you're glad. I feel sad when you're sad. If you only knew what I'm going through, I just can't smile without you. L is for the way you look at me. O is for the only one I see. V is very, very extraordinary. E is even more than anyone that you adore. Love is all that I can give to you. Love is more than just a game for two. Two in love can make it. Take my heart, but please don't break it. Love was made for me and you. Love is all that I can give to you. Love is more than just a game for two. Two in love can make it. Take my heart, but please don't break it. Love.
You don't need to punish your body to transform it before summer. If your booty looks like this, your belly looks like this, and your arms looks like this, join our beginner Tai Chi challenge this Monday, May 11th. Forget the gym. 9 minutes of Tai Chi walking is doing more for women over 45 than an hour on the machines.
Ladies over 180 pounds, if you want to become unrecognizable by summer, on Monday, May 11th, we're launching a beginner-friendly Tai Chi walking program for women. You'll safely firm your body, calm your mind, and start burning stubborn belly fat. By May 18th, you'll feel firmer and more energized. By May 25th, you'll be surprised by your waistline. By June 1st, you'll feel proud of your body and connected to it. All you have to do is open the app, Take the first step and follow the program. Your walking therapy and your new body start here. What worked in your 20s won't work now. Join our Tai Chi walking flow starting Monday, May 11th. After 50, weight loss isn't about doing more. It's about doing what works. Tai Chi walking is a low-impact, hormone-friendly method that helps women lose weight gently and consistently. With just 7 minutes a day, you strengthen your body, calm your nervous system, and support steady weight loss. In 1 week, you'll feel lighter and more energized. In 2 weeks, you'll see changes in your waist and posture. In a few weeks, others will notice your transformation. This isn't a workout. It's a smarter way to change your body. Join the Tai Chi walking program today. Tap the link and download the app.
You don't need to walk 10,000 steps to lose weight. That is a myth.
Yeah.
Tai Chi walking is actually just math.
Yeah.
But you need to know your variables. Your age, your weight, your sleep patterns, and your joint pain determine the intensity you need. That's why we built this quiz. It analyzes your body state and gives you a daily Tai Chi walking routine. For most women, it's just 9 minutes a day tailored to their metabolism. No equipment, no confusion. Want to lose 25 pounds? You get a specific low impact plan. Want to lose 50? You get a different one. Take the quiz to see your personal plan. Link is below.
Sweet like sugar, sugar. That's what she needs. Sugar, sugar. She said the sweeter the love makes it real. Flavor, it means a lot. She loves a certain taste. And when it's sweet, you see it on her face. I lay it down, ready for her to take. Oh, if it's sugar, sugar you want, and the sugar you need. Tell me that should I follow your lead? Not even the chocolate chip, as sweet as the candy stick. Sugar, sugar you want, and the sugar you need. Tell me that should I follow your lead?